Now to other news, because it's 4 months now since Kabul fell to the Taliban and they retook control of Afghanistan. During that time, the economy has been in freefall and overwhelming the medical system, which has struggled to cope with the spread of COVID there. Hunger is everywhere. Millions are at risk of starvation. Well, earlier I spoke with our correspondent in Kabul, Secunder Kermani, about the scale of the crisis, what he has seen in the country.
Well, Matthew, you can see around me it's the first snow of the season here in Kabul. Real concern about what the colder weather is going to do to this humanitarian crisis, particularly in those parts of the country where the weather's even colder than it is here. We were in the remote province of Ghor. It's around 10 hours drive away from here through mountain passes that, well, could quite possibly be cut off by this kind of weather pretty soon. And there's real concern about the humanitarian crisis that's engulfing this country. What we saw in this hospital is really repeated in hospitals right across Afghanistan. Here's our report filmed by cameraman Malik Mudassir. A nation struggling to survive. A hospital struggling to cope. The war is over in Afghanistan, but hunger is the new threat. These mothers desperately waiting for nutrition packs for their malnourished babies. A million children are at risk of starvation. With international funding cut off following the Taliban takeover, Afghanistan's aid-dependent economy is collapsing. Life for many here has always been hard, but with food prices and unemployment rising, more families than ever recorded are going hungry.
برای فعلا 2 بستر حتی ما 3 نفر را میشونیم به 1 بستر. نمی روزی که بیام آمدن نمی مریض 1 روپیه پول نداشت که به خود خو بگیره. ما فقط همیشه شفاخانه است. حتی دکتر صاحبای ما بگرفتن همیشه مثلا دوا کمک کردن میگرفتن به ای بدادن که تی رسیده.
We've come to the remote province of Ghor. It's a 10-hour drive to the nearest big city. The snow here picturesque, but there's less than usual. Drought is adding to the crisis. We're visiting the province's only hospital. Staff are being paid for the first time in 5 months after the International Committee of the Red Cross stepped in. But most patients have to buy their own medicines. The supplies are so low.
We don't have anything now. There's a lot of
medicines
no medicines. Yeah.
How difficult is it for you as a doctor?
We're suffering, just sometimes crying.
If you want to get an idea of how dysfunctional things here can be, this is a child malnutrition ward. Temperatures here can drop to -10 degrees Celsius at night, even lower at times. They've only got enough wood in this heater to last a couple of hours. In the past, the Ministry of Health used to buy them all the fuel they needed. Now, it simply doesn't have the money. Dr. Parsa is the head of the hospital. He's been paying out of his own pocket for 6 extra nurses just to keep essential services running.
بیایم به جامعه جهانی است. از این حالت بدتر خود سر مردم ما نمیآید. لطفاً کمک‌های بشردوستانه خود به مردم ما برسانم. در غیر آن با حکومت امارت اسلامی مذاکره کنه و پول منجمد شده حکومت امارت اسلامی را آزاد بسازه.
It's not just hunger they're battling here. With the onset of winter, cases of severe pneumonia are on the rise. On the measles ward, we find the starkest example of the pressure on resources. Vaccine campaigns were disrupted by COVID and the war. Outbreaks of this preventable disease are common. Last night, a young child died due to a lack of oxygen.
We cannot afford, we cannot buy these cylinders. They are expensive.
How much is a cylinder?
About 500 5,000 Afghanis.
You couldn't afford an oxygen cylinder for $50, and because of that, a child died.
Yes.
A new life born into an uncertain world. Even when billions of dollars of international support were coming in, hospitals here were badly under-resourced. Now, staff are doing what they can, but they say they need help.
Secunder, a really distressing report there. There have been warnings for months about the humanitarian situation. Is it clear to you how fast things are actually deteriorating?
Well, they're deteriorating fast. I mean, look, some humanitarian aid is getting into the country. That's important to stress. But the scale of this disaster means that much more is needed, it seems. A lot of analysts that I speak to say that the issues here in Afghanistan are even more deep-rooted than humanitarian aid can solve. I mean, we're talking about the previous government. Around 75% of their public spending came from foreign grants, and that pretty much vanished overnight when the Taliban took over in August. It was clearly, many would say, an unsustainable model for a country to run itself. But the question is, what's going to be the future of Afghanistan now? How will public services be paid for if that international aid is not going to be forthcoming? Humanitarian aid can only go so far, and those are big questions that are yet really to be resolved, with the West still deeply concerned about strengthening or endorsing the Taliban government in any way. The Taliban saying that they want their funds unfrozen, but so far not really being very clear about what they're willing to compromise on, if anything, in order to get that. And in the middle of all of this, of course, ordinary Afghan people.
Yes, exactly on that point. Clearly questions for the West to answer. But when you talk to the Taliban, apart from saying we need assets unfrozen, what are they saying about coping with all of this in these immediate weeks?
Well, the sense that you get from the Taliban is that they see this crisis really as the responsibility not so much of them, but of the international community. And that's why you've just got these repeated demands from them for the roughly $10 billion of foreign reserves to be unfrozen. That's what the Taliban have been saying. They do at times come out with statements that appear to be aimed at addressing some of the concerns of the international community, like when Human Rights Watch, for example, talked about extrajudicial killings being carried out in recent weeks and months. They said that they'd allow a independent investigation in the face of a lot of sustained criticism about their tone or their policy towards women's rights. They came out with a decree on women's rights of their own, but they failed to address many of the key concerns. So that decree, for example, didn't talk about whether girls would be able to go to school, about whether women would be able to work. So a lot of concern really from ordinary Afghan people about whether the Taliban are equipped to handle this crisis. And as I say, the attitude from the Taliban seems to be that this is not a crisis of their making, is a crisis as they see it, of the international community's doing, and they're the ones who need to step in.